we use probiotics such as our powder, Bifido Maximus, and we get to 7 capsules a day, or Microbiome Mojo, 7 capsules a day, that's 700 billion CFUs, we're getting really close to a fecal microbiota transplant dose, which is about a 1/4 cup of poop. So poop is really healing, but I think we can do better. Well, not better, but we can do, equally good with something as potent as Microbiome Mojo or Bifido Maximus. Really crazy good, right? Now, how about the microbiome? We know the bladder is super infected and colonized, invaded by fungi. And how have they discovered more about the origin? Well, they actually haven't. I couldn't find anything. I kind of dug a little bit briefly and have not seen too much. So it's kind of an emerging field, but again, with next-gen sequencing, we really didn't even see much until recently, the last 10, 15, 10 years. So this is all rather new, but it kind of is confirming what we know in Chinese medicine, meridians, and other non-Western forms of medicine. So we saw this yesterday. There's a huge overlap, 62%, 64%, 67% of urine microbiota bacteria corresponding to the gut microbiome. Now, if we broke down what's in the bladder, what's healthy versus not healthy. So this is what researchers have drilled down. For men and women, most of the phyla, we have like 6, 7, 8 phyla in our body with 16S sequencing. They found they're mostly the same. And the majority belong to Firmicutes. This is where lactobacilli is located. It's also where our butyrate makers are. In men, it's 65%, and women pretty close, 73%. And when they drill down other phyla, actinobacteria, men have a little less than women. Men have 15% actino. When you drill it down, women 19%. This is where we have Bifido. So important. This is Bifido that follows us from birth all the way to being older and healthy, like as a centenarian. And then for Bacteroidetes, 10% in men, only 3% in female bladders. And then Proteobacter, maybe this is because men, the skin and the urethra are so connected. Proteobacter is higher in men, 8%, whereas in women only 3%. And this is where E. coli and certain Enterobacter pathogens sometimes are often located. Proteobacter. We need good Proteobacter, which is sometimes found in water and environmental sources and other outdoor areas, versus the more, disease-causing Proteobacter, like coliforms found in hot tubs and swimming pools. We don't want so much of that. And food poisoning, right? Most genera are shared in the urinary microbiome in both healthy men and women. So there's huge overlap with men and women. And that makes sense because we're so close. There's household contact and partner contact and all kinds of contact, right? Common genera are Prevotella, Escherichia, Enterococcus, Strep, and Citrobacter, among others. Well, I'll show a case where there's interstitial cystitis, a huge amount of Klebsiella in the bladder, in the urine collection. Pseudomonas has only been described in men, interestingly. Corynebacterium and Strep are more also abundant in men. Lactobacilli more abundant in women, particularly Lactobacillus crispus in very healthy bladders. And we talked about the role of Lactobacillus crispus for the vaginal health. It is the key marker indicator. So with acute UTI and recurrent UTI, we're going to briefly go over Western guidelines, but not go into any depth. But what it has really emerged is high drug resistance. And these are even changing the Western medicine treatment guidelines. In the newest guidelines in the last just couple years, practitioners are actually encouraged to discuss non-antibiotic therapy and offer these non-antibiotic lifestyle changes and even probiotics, which is wild to me. And if it's a recurrent and uncomplicated cystitis, it's even in the Western guidelines, individual risk factors should be assessed, they're promoting, and even behavioral changes. And many of the prophylactic treatments, they exist, but they are definitely not encouraged to do antibacterial treatments long-term or even short-term right now. Really not encouraged anymore because of high drug resistance, multi-drug resistance, and that's it changes actually the whole pattern found in hospitals and community settings. And I think also they're seeing other complications. So they even encourage people can treat on their own, using a questionnaire, self-diagnose and self-treat using over-the-counters, which I found pretty helpful for clients also just even 20 years ago. So for women, there's a high prevalence, more than men. UTI prevalence is at least 1 billion per year globally in women. And the UTI can last several days. There's sequelae, with recurrence and interstitial cystitis, as well as the infection going up, pyelonephritis to the kidneys and the full kidney disease, pelvic inflammatory disease that can lead to infertility and many other issues, urosepsis, especially in elderly, it's pretty asymptomatic. I used to work in long-term care. My residency's in long-term care and elderly, and wow, like if some patient just suddenly didn't act normal, the first thing we would do, of course, is culture their urine and then treat a UTI, and they would immediately get better, like full cognition back. Preterm birth is also a potential complication for recurrent UTI. The uropathogen scene there's yeast present. E. coli makes up 70% of the bacterial infections. Enterobacter and strep and staphylococcus are leading up to that. So globally, there's increasing drug resistance, super problematic with the uropathogen scene. And this affects hospital antibiograms and community setting antibiograms, where the algorithms have changed. And if there's a resistance pattern in the E. coli scene, more than 20% locally, then they have to shift to a different antibiotic. And diagnosis is usually urine culture and sometimes microscopy. I don't think I've seen too much genetic testing yet on that. So it can be 11% of women a year are expected, they have a prevalence to have a UTI. That's like 1 out of 10 of us every year. And that seems to be the case for people, a lot of friends I know who aren't on this like holistic path. 80% of all women across the globe experience at least one uncomplicated UTI in their lifetime, at least one. And as many as 45% will have recurrence of this uncomplicated, but still recurring 3 to 4 times a year. That's a lot. And uncomplicated UTIs, they're a substantial economic burden, and as well as being present with your family and friends, work, and even exercising and all daily kind of actions. It's definitely affects quality of life. It sucks, like people feel sick, sometimes hurts when they are going through that, either even over the counter or taking a prescription.